another edition of In and About, where we showcase events and businesses in and around Abuja. On today's edition, we'll be looking at the FCT Emergency Medical Services and Ambulance System. My name is Elizabeth Ereke, your anchor. On the program today, I have the program manager of the FCT Emergency Medical Services and Ambulance System, Dr. Ozzy Okonohwa. You're welcome to the show.
Thank you very much for having me.
I love the smile on your face.
Yours too, it's infectious.
Thank you. But before then, do well to subscribe to our social media handles on Facebook, Instagram, and X. It's at ClickNiger1. You can subscribe to our YouTube channel at ClickNiger. Log on to our website on www.clickniger.gov.ng and listen to us 247 on Radio Garden. It's Click Niger. Back to you, Doctor. Your services in the FCT has to do with medical emergencies and ambulance system. What necessitated this initiative?
All right, thank you very much. Before now, we know that there has been need for emergency response to persons who require such services, but it has not been very well organized or structured. So in the year 2022, the federal government, under the current administration, came up with an initiative that is called National Emergency Service and Ambulance System, NEMSAS. And this is an initiative that is aimed at reducing the response time for emergencies across the length and breadth of Nigeria. FCT was chosen as a pilot state, and so in about August 2022, this scheme was kicked off so that we can reduce, the number of deaths that we normally record from medical emergencies. And also because we want to use this as an initiative to cut down on the number of women that are dying because they're not able to, be conveyed quickly to the hospitals for delivery. So it's a two-pronged approach. One, to reduce emergencies in the urban settings, where people are collapsing either due to one stress or the other, and also to see how we can cut down on maternal and child mortality arising from failure to access, medical services in the rural communities. So that's the two-pronged approach, just to see how we can cut down the number of people who are not able to access medical care because they are not close to the hospital. If somebody has reached the hospital, there's no longer an emergency, as it were, because transportation has already been taken care of. But what of the man or the woman that is far flung from the hospital and is in dire need of medical emergency? And that is where the ambulance services actually comes in.
Okay. But then we still have cases of patients or people losing their lives, and when you ask they'll be like, "Oh, we called the ambulance service and they were not prompt to answering and all whatnot." Would you say that so far the agency or the emergency management system has been able to deliver on its mandate of reaching out and saving these, will I call them, vulnerable people in the rural areas?
Oh, yes. For as long as you're able to put a call across to the emergency medical service and ambulance system across the states, we get quick responses. There may be some instances where, response doesn't get there on time. Maybe the place is far flung, or, because of other infrastructural deficiencies that we have. If the person is in a locality where access road is not easily navigated, of course, there'll be some delay. But where we are in areas where there is good infrastructure, we're able to respond within maximum 10 minutes we're at the location. And we're also trying to cut down on this number. How do we do this? We leverage on existing structures. Road safety has a huge number of ambulances spread across. They're already deployed. Civil defense also has, ambulances already deployed. So we leverage on such partnership. If the place is too far from us, we call the nearest, zebra, which is what the road safety normally call their ambulances. So we call the nearest zebra, and they quickly go there and pick up the victims in case of road crashes. And let's not forget that sometimes there's a delay in calling for an ambulance. What happens in the event of a medical emergency? What do we normally find? Persons cluster around this victim and they start recording, videos that they post online. And that moment of recording, you are taking away the response time from the medical emergency responders. So that is one big challenge that we have. And again, There's also apathy, general disbelief in the system that things can actually work. So there's a medical emergency. Instead of you calling for an ambulance, somebody picks up his car or picks up his Okada and straps the person on the vehicle and starts rushing the person to the hospital. So, but whenever we are called, especially as at the FCT Emergency Medical Service and Ambulance System call center, we respond by dispatching an ambulance as quickly as possible in order to save time. We are very much aware of the golden hour or even the golden minute that is required to save a life. So we don't joke with, like, that's what we are engaged to do, at the FCT Emergency Medical Service and Ambulance System.
Okay, so are there specific people, because you talked on the rural areas, what about those in the urban areas? That could maybe possibly afford to get to the hospital, could they still enjoy this kind of services? Or you're just particular about a certain class of people?
Oh, no, way. Like what we normally say in this space is that when, for instance, God forbid that Dangote slumps and collapses now, there's no identity that is going to be on him that will make us speed up the response. The same emergency medical response we are going to provide for the unknown John Doe. That's the same emergency medical response we're going to provide to the highest or the richest person. Now, we have actually been recording more successes in the urban setting, because Nigerians are more aware, they are more conscious of the need of these services. The numbers are readily available. So once such numbers are called, we respond, as quickly as possible. Now, to see how I could address the concern you raised for the person who walks into the hospital, for instance, under this scheme, if we are not the one that transported you from the scene to the hospital, you may end up spending your own money at the hospital. But if we are the ones, if you call our rescue numbers and we pick you up from any part of the city, we are not going to charge you for the ambulance transportation. We're also not going to charge you for the services you got while you're being, or the treatments you got in the ambulance while you're being taken to the hospital. And by the time you get to the hospital, you are going to receive treatment for the first 48 hours free of charge at some designated hospital. So you have to actually be onboarded into the scheme by that simple phone call. Once you call us and we dispatch our ambulance, from the point of picking you up to the next 48 hours, you're not spending anything from your pocket. All right. However, if, for instance, you walk into other centers, especially like tertiary hospitals like National Hospital Abuja, for any medical emergency, and you go to their A&E, and we don't expect you to pay anything under this scheme. For the first 48 hours, it is provided free. Government has already made provisions for paying for these services, so you don't need to pay anything. And that's what we do in the FCT, for instance, at our own secondary healthcare facilities. Once we pick you with our ambulance, or we're the ones that you called, and we pick you up at any location in the FCT, we'll take you to accredited centers and treat you for the first 48 hours free of charge.
Okay, so is it safe to say you have partners with, will I say all the hospitals or some hospitals in the FCT? Why do I ask this question? I have a little concern of you getting immediate medical care when you get to the hospital via calling your emergency system. Is it a straight cut, oh, we've gotten this call, and your organization reaches out to the hospital to give prompt attention to the person? How does it work?
What happens is that once you call us, and we identify your location as, say, spot A, let's say in Wuse, we know that we're going to pick you up in Wuse. We will call the hospital that we're sending you to ahead of time. And ambulance ABC is bringing patient A to your emergency medical unit. So please get ready. So they are set to receive the patient.
Okay.
So before you get there, the hospital is already aware and they are prepared to receive you and provide necessary treatment for the first.
Is it just government hospitals or any hospital close to the patient you're transporting there?
Now, for now, we have to make sure that hospital is certified for the service that you're going to receive. So currently, we've been able to get all our secondary healthcare facilities, all the general hospitals, they have already been, certified. Okay. We have selected some private hospitals to be on the scheme. Now, we don't just send to any hospital. Okay. We have to go and verify that hospital is able to render such services before we can actually onboard them. So we have a few private hospitals that are also part of the scheme. In short, only last week, another hospital applied to join us. So every now and then we keep getting requests that they want to be part and parcel of the scheme. Because they are reimbursed for every treatment that they provide.
Okay.
And they are reimbursed using the National Health Agency tariff.
Okay.
The National Health,
So
Insurance Agency tariff.
so is it different from the National Health Insurance Scheme?
It works hand in hand with the National Health Insurance. You don't even need to subscribe to the National Insurance Scheme.
For somebody that is not working or doing anything, that doesn't have the opportunity to subscribe, what happens?
For somebody who is facing a medical emergency, we ask limited questions.
Oh, okay.
The idea is to provide treatment. So we'll not be asking you what's your NHIA, what's this one. You're giving treatment for the first 48 hours. By that time, you would have stabilized. Now, the hospital will now send us bill using the NHIA tariff. So the tariff has nothing to do with the patient. It is the hospital, however, that must subscribe to the National Health Insurance Agency.
Okay.
Before we can use them. So those are some of the things we normally look out for.
The program is In and About on Click Ninja online channel, and I've been speaking with Dr. Ozzy Onokoa on the FCT Emergency Management and Ambulance System. Dr. Ozzy, you said something about having free 48-hour treatment. Do you have personnel that see this through, or you just take the person, your work ends when you keep the person or you bring the person to the hospital and you move on, having in mind that this person is supposed to have this treatment for 48 hours? How do you?
Now, every hospital that we work with must sign an MOU with us. So in that memorandum of understanding, all the standard operating procedures are well spelled out. So you're expected to ensure that this patient is stabilized and is at least able to leave the emergency room within the first 48 hours. We agree that there are some cases that may go beyond 48 hours in terms of management, depending on the severity, of the emergency medical treatment that patient will require. But they are very few. But we expect that for the first 48 hours, you would have been able to manage such patients. So we don't just send you to any hospital that we have not accredited. And that accreditation process is actually very stringent. We make sure that you have the right personnel, your personnel have the right attitude, and you also have the right know-how.
You know why I'm smiling?
Yes, tell me.
Because over time, we've had cases of NHIS patients or subscribers complaining that when they get to hospitals, down to the drugs that they are being administered are different from the regular subscribers of these hospitals. Is that applicable to you, or they are given the same standard attention as any other person that independently comes into the hospital?
For emergency medical treatment, the first assignment is to save the person's life. So you are going to use the best drug that will ensure that this patient is saved. It is when you have left emergency that you're not talking about whether you should use this brand of paracetamol or that brand of paracetamol.
So why don't we see through that the first treatment that was given to this personnel scales throughout the period of time, even after the 48-hour free medical services?
Now you have left. I'm the program manager of the emergency medical service and ambulance system. You are taking me into managed care and health insurance.
No, I'm not. Well, you said you have a partnership, you have an MOU. So maybe I'm just trying to dig into what you people have agreed on. This is what you people have agreed to render. You are giving out the best because you said something. The first, when you're on emergency, they give you the best of the best. After that, should we go back to status quo of, this person is not our...
I don't actually think that hospitals deliberately decide to segregate the type of treatment they are going to give patient A and patient B, depending on whether they are insurance patients or not. Now, as a matter of fact, if you actually look at the principle of insurance, it means that this patient has paid well ahead of time. So that patient should actually be receiving the best treatment. That is the principle of health insurance. The reason why I'm giving you money ahead of time is that when I come, I don't want to waste time, and I want to get the best of treatment. So under the principles that guides health insurance, everybody who has subscribed to the National Health Insurance Scheme or under the National Health Insurance Agency, whether it is states or national, should actually be receiving the best treatment. You should be given a VIP treatment. I shouldn't have to go and queue up with others who did not subscribe well ahead of time. You have my details, you have my money. I should get the best treatment.
You know why I'm laughing? Because it's the other way around of what we actually see in reality. But then maybe we could get better.
We will
And
get there.
maybe people will help us, since you're still part of your partners in progress. You could still help, maybe chip in one or two to just stabilize.
I see, all of us, we are stakeholders, including the media houses.
Of course.
We are all stakeholders in this thing. The moment we relax, people now take advantage of the fact nobody's talking about it. But we must keep talking about it so that consciousness is raised and the right thing is done.
Okay, so are there numbers people who want to key into your services could call to reach out to you? Numbers, email addresses, social media handles, whatever?
Okay, numbers are usually faster for us, so we have two numbers that are directly linked to the FCT Emergency Medical Service and Ambulance System. And they are 11-digit numbers, 091 5789 2931. 091 5789 2932. And then we have a toll-free number that you can actually call. That's directly to the NCC, is the 112 number. But our own number that comes directly to our office is 091 5789 2931 and 091 5789 2932. When you call either of these numbers, you call directly to our office and requesting for an ambulance. In case of an emergency, an ambulance will be sent to you. For medical emergencies only, medical emergencies. We will not respond to fire, we will not respond to theft, we will not respond to building collapse, but we'll respond to medical emergency. Somebody collapsed, somebody is choking, a pregnant woman is having challenges, somebody fell down in a road traffic accident, we'll respond quickly.
Okay. So you said you operate within the FCT as the, what I call it, the formative state or the test run
Yes, the
state.
pilot state.
Have you spread your tentacles to other states, or you just still focused in the FCT?
No, it has gone to, I think only about maybe 3 or 4 states have not actually onboarded. Okay. All the states, most of the states in the north, states in the southeast, southwest, northeast, even all the states in the south, I think have been fully onboarded into the scheme. But for maybe 1 or 2 states, I think perhaps Imo or one of the states have not actually onboarded into the scheme. Okay. Since it was flagged off in the FCT in 2022, it has spread. The national program manager has been very instrumental in ensuring that it's spread across all the states in Nigeria.
Okay, so how do I maybe read up about you? Do you have a website? You have maybe a Facebook, an Instagram, or whatever page that, I've heard about these people. Let me read more about them. Let me see what they actually do before I key into. We have this mentality in Nigeria that nothing works. All this one, they will say a story.
Yeah.
Good policies, but not evident. So where can we go to see physically, not just calling, that these people actually exist and they are actually doing what they say they should do?
Okay, the National Emergency Medical Service and Ambulance System is part of the Federal Ministry of Health. So once you log on to the Federal Ministry of Health website and you scroll down to hit the NEMSAS platform, you get all the states that are fully onboarded and the type of services that is rendered across Nigeria. For the FCT, I think the FCT Instagram handle is FCT_EMSAS. Okay. FCT_EMSAS. That's where you get the FCT, Emergency Medical Service and Ambulance System handle. So
in cases of complaints, where do we reach out? What numbers do we call? What email address should we send our complaints to?
For whether it is call complaints, call the numbers that I just listed.
But what if I now call the number for a complaint and I'm yanked off or I am shut down? Are there people that monitor these calls?
Oh yes. I monitor the calls on a daily basis.
Okay.
Yes, because it serves both as our call center and as our emergency medical response numbers.
Okay.
So, and surprisingly, we get a lot of people who just want to make inquiries. Oh, these numbers, we heard about it. We just want to be sure it's actually working. So we get a lot of that, all the time. But we say as much as possible, let it be for actual medical emergencies. Okay. But if you have complaints, and that has to do with our own services, please do feel free to call those numbers and you get the required response.
Directly your response, right?
Yes, you get directly.
All right, then, before we take our leave, because we're gradually rounding up the show, how well, within the range of 1 to 10, would you rate the progress or the successes achieved by your system?
All right, thank you. It's work in progress, and I must say, I will use this opportunity to commend the Mandate Secretary, FCT, Health Service and Environment Secretariat, who has taken up this initiative to rebrand and restructure the FCT Emergency Medical Service and Ambulance System. And only recently, the FCT minister actually gave us 12 new ambulances to further beef up emergency medical services, ambulance services in the FCT. So if I'm going to rate, our successes so far, I'm almost going to say 10 over 10. But because I want room for improvement, I'm going to say 6 so that we can still grow within the remaining.
So 6 is fair.
6 is fair, because we rate our services based on the number of lives we're able to save. And currently, a lot of Nigerians have not started believing in this system. How many Nigerians actually believe that when you call for an ambulance, you will get one? Just like you do abroad, you call 911 and an ambulance comes. Yeah. That's actually what we want to get to. But Nigerians still now believe that once there's an emergency, a man will put his wife in his vehicle to take her to the hospital. But abroad, you call for an ambulance. Yeah. And that's what we want to achieve, so that you don't need to do it yourself. So we have ambulances that are just waiting for phone calls. But they're not getting the phone calls because Nigerians do not believe that they can actually call.
You now see why I asked that saying is believing questions.
Yes.
Let's go.
But
see.
those, I could have shared a video with you of a woman who called and an ambulance was dispatched to her house.
But you can actually share the video.
I will share with you.
Yeah.
Yes, this is me. I'm the mother of the patient. That is the good luck. And I want to thank you once again for the opportunity of helping to save this life. Although we all know that it's God that heals, but the doctor tried. They tried and they give the care, but the ultimate cure is from God. But before God will intervene, is people God use. And I want to thank you once more. And I also want to thank the Nigerian government and also National Hospital. They've done their job. So please, let us help to continue to advocate for the government. Use all the internet, all the facilities that has been put in place so that we can also move Nigeria forward. Stop saying bad about your country. And God will help us all. Thank you.
You see the response. The woman was so excited. She couldn't believe it. That ambulance can actually come and pick up her son just because she placed a call. And she was not charged anything. So we have such, testimonies to show that this is what we are doing.
So you said a lot of people do not believe that this kind of services exist. Knowing this, what effort have you put in place to make more awareness to people that we actually have these things, and they are working? Have you maybe taken campaigns to the rural areas? Have you taken campaigns to even public schools, offices, to tell people that we have these things? What have you done on your own part to bring up more publicity on your services?
I've been doing that. We have been doing that as FCT Emergency Medical Service and Ambulance, and that's even one of the reasons why we're here. Mm-hmm. So we've been going from one media house to the other. Only towards the late end of last year, we're in Yanya Motor Park, in conjunction with the Federal Safety Corps, seeing how we could also spread information regarding our services, as regularly as possible. Before I came here, I just came back from a meeting with the Female Drivers Association of Nigeria. And we also let them know that we can actually do this work together. So they've also been recruited as, change agents to continue to spread this message across. And every now and then we go to churches, we go to mosques to share this information. We have handbills that we've been distributing across the FCT that also contains our numbers so that people can actually be aware that these services is actually available for them free of charge. There are some ambulance service providers in the FCT that are paid services. You call them, you pay. But the one that FCT is providing is free of charge. You don't need to pay a dime. And it is readily available across the 6 area councils of the FCT. Call for an ambulance using those numbers that I already mentioned, and an ambulance will be sent to you. and you will not pay anything. On top of that, any hospital that they are taking to, you will not pay anything at all for the first 48 hours.
You've heard it right. You are not going to pay anything when you call their numbers, and then free treatment will be given to you for 48 hours. I would like Dr. Ozzy Okonowa to call those numbers again as we wrap up the show before we say our final goodbyes.
Thank you very much. So the numbers to call for medical emergency response is 091 5789 2931 or 091 5789 2932. Whenever you call for an ambulance using those numbers, you'll get an ambulance immediately.
Thank you very much, Dr. Ozzy Okonowa, for being a part of today's edition. On this note, we call it a wrap on today's edition of In and About, where we showcase businesses and events in the FCT and its environs. Until I come your way again next time, I am Elizabeth.